Hello there. Congratulations on the birth of your baby. Now that we have done our discharge vitals on you and your baby, and we've established a good routine. Baby's doing well, you're doing well, and everyone's nice and rested. I'm gonna go ahead and issue you your discharge information. We're gonna talk about postpartum care. Now, I will return in 24 to 36 hours, but this is information that you're going to keep with you after I leave the first appointment, and then after we're all done with our final postpartum appointment. And these are also certain things that we're going to go over that should warrant a call to me if anything seems out of the ordinary or worrisome. And you can always just reach out to me in the meantime while you're still under my care. So, the first thing we're going to talk about are the most important things to keep a lookout on that would warrant calling me, your midwife. So, heavy bleeding. And heavy bleeding is like soaking one or more large pads in an hour for 2 consecutive hours. If you pass a clot that's bigger than a golf ball, bigger than like oftentimes the size of your hand, golf ball, call me. Size of your hand, definitely immediately call me. If you have bleeding that becomes really heavy and won't slow down, fever over 100.4, chills, shakes, if you're having discharge from your vagina that is foul smelling, or pelvic or uterine pain that is increasing. These sort of things we want to watch out for that might alert to me that there's an issue with your blood pressure. If you have a severe headache that does not subside with rest or hydration or ibuprofen, if you have blurry vision, seeing spots, flashing lights, swelling in your hands or face, pain in the upper right abdomen, shortness of breath, like it's really hard for you to breathe. If you're having There will be definitely some changes with your breasts or chest, but definitely alert me if you're noticing redness, pain, or warming on the breasts. But we can have a conversation on what type of pain is alarming and what type of pain is normal, because there will definitely be some sensation changes with your milk supply coming in. If you have breast or chest pain coupled with a fever, or if you're feeling any lumps and they're painful and they don't improve after a feed. Obviously, call me, speak to your partner, or if you already have a mental health care provider for emotional well being, there will definitely be some emotional changes happening. So just call me. I'm always here to help you. If you're having any anxiety, feeling detachment from the baby, any thoughts of harm to yourself or the baby, please, please, please call me. Increasing abdomen pain, difficulty breathing, burning when you urinate. If you did have stitching, let me know if the stitch is open or there's pain increasing down there. For the baby, we're going to talk about breastfeeding really quickly and also elimination. So your baby should be eating at least 8 to 12 times every 24 hours. That number is a spectrum. Some babies are very sleepy, some parents supply a really good amount immediately, and so the baby is getting very, very full in one session and might have fewer feeds. Know your baby's cues, like lip smacking, rooting towards the breast, hands to mouth, sometimes, not often, with a very newborn baby, and then that sucking motion in their mouth. A good latch is when the lips are flanged outward. You hear like a rhythmic sucking or swallowing. It feels comfortable when they latch, like it doesn't hurt. And you see more areola is visible above the baby's upper lip than below, because you want it to be more like this, not necessarily like that. You should expect your colostrum in the first few days. The milk does usually increase around 2 to 5 days. Again, that number is a spectrum. Everyone is different. When I return in the next 24 to 36 hours, we can talk about what to expect with your fore milk coming in and what it'll look like and how much of it you could expect and all the things that should make you feel comfortable to know that your baby is getting enough milk and that your supply will come in soon. Definitely call me if the baby is difficult to wake for feeds, the baby's not feeding at least 8 times in a 24-hour period, 6 to 8 times, I'd say. You have pain while you're nursing, you have cracked, bleeding, or really, really painful nipples. Your baby has fewer wet diapers than expected, and then we'll go over how many wet diapers to expect between 24 and 48 hours. Your milk hasn't come in by day 5, or your baby appears like jaundice and lethargic or like losing weight. Those are definitely like big alarming signs. And then jaundice obviously is when they're looking yellowish. Definitely change your pads frequently. Wash your hands when you're changing your pads. Use a peri bottle with warm water, and if I've given you herbs, put those herbs in your peri bottle. These are all things to help with perineal care, and you should expect the perineal area to heal in a few weeks. That number is a spectrum depending on how much rest you actually give yourself and perhaps how severe the laceration was. For comfort, I recommend ibuprofen, acetaminophen. Drink plenty of fluids, eat lots of fiber-rich foods, leafy greens, perhaps even a stool softener if you're experiencing hemorrhoids and constipation. Call me if the perineal pain worsens, if you might not notice redness, but you perhaps might notice swelling or foul-smelling drainage. Again, if your stitches separate, and if you notice that the swelling that you do have is increasing. For the umbilical cord, you're gonna have a really, really ugly umbilical cord on your baby. It's really, really important that you let the umbilical cord stay dry and clean. Typically, we would like to avoid a full submersion bath in the first few weeks until the umbilical cord has fallen off. So, use a wet cloth, warm water, no need for soap really, just nice and clean around the baby, especially around the mouth area where milk might dribble, the hands, and the diaper area. Don't apply any sort of alcohols or lotions or powders or ointments. Just keep it very, very dry. Let the elements do its thing. Open clothing, I always recommend the ones where the umbilical cord is showing. So like a nice little top for the baby instead of like a onesie. That's what I would personally recommend. It should fall off in 1 to 3 weeks. It should definitely fall off before our last postpartum appointment. So I will be checking on that when that time comes. Call me if there's any redness around the baby's abdomen. If you notice that there's some foul-smelling drainage coming from the umbilical cord area, if it's swollen or tender, or if your baby becomes feverish or ill, and it's okay if a little bit of blood or plasma comes out of the stump when it falls off. That can be very normal. I definitely I want you to prioritize rest for several weeks. Avoid heavy lifting. Avoid going up and down stairs if you live in a 2-story. You can gradually increase activity, but further over time, maybe in a week you can go outside and get the mail or get the DoorDash. Any instructions that I give you, I would definitely recommend taking into heart. Oh, we're losing light here, so sorry. Hydrate. That's definitely going to help your milk supply. Eat really, really good meals. That's going to help the nutrition in your supply, in your milk supply. It's also going to help balance out the nutrition that you give to your baby. So you want to make sure that you're supplementing and giving it back to yourself to give you vitality and energy. I definitely recommend continuing your prenatal vitamins. And again, I will return in 24 to 36 hours for your first postpartum visit, and then we'll conduct a newborn exam, assess the gest and breastfeeding, assess vaginal or perineal status, and again, contact me sooner if any of the concerns that we've spoken about already arise between visits. In an emergency situation such as chest pain or difficulty breathing, call 911 and go to your nearest emergency medical center, okay? Also, seizures, loss of consciousness, obviously, heavy uncontrolled bleeding, thoughts of harming yourself, or and you cannot remain safe. I recommend giving my number to your closest, your most trusting partner, your partner, family member, neighbor, someone you trust the most. In case you can't get to the phone, they can get to the phone and contact 911 or myself. Thank you so much, and I will see you in just about a day. Okay, rest up.